Is Ozempic safe? The safety of Ozempic, semaglutide, depends on individual factors, such as your overall health, medical history, and how well you tolerate the medication. It is considered generally safe for many people when prescribed and monitored by a healthcare provider, but it does have potential risks and side effects that should be carefully considered. Safety profile, FDA approval and clinical trials. Ozempic is approved by the U.S. Food and Drug Administration, FDA, for the treatment of type 2 diabetes and has also been approved for chronic weight management in adults with obesity or overweight who have at least one weight-related condition. The approval was based on extensive clinical trials that demonstrated its efficacy and safety for these purposes. These trials showed that Ozempic effectively lowers blood sugar levels and promotes weight loss while having a manageable side effect profile for most users. Ozempic, known generically as semaglutide, is a glucagon-like peptide 1, GLP-1, receptor agonist primarily used to manage type 2 diabetes and, more recently, for weight loss in individuals with obesity or overweight conditions. Although it offers significant benefits in managing blood sugar levels and promoting weight loss, it is essential to understand its side effects and risks. Serious side effects. Pancreatitis. Pancreatitis, or inflammation of the pancreas, is a serious but rare side effect of Ozempic. Symptoms of pancreatitis include severe abdominal pain, nausea, vomiting, and fever. This condition requires immediate medical attention, as it can lead to severe complications if left untreated. Patients with a history of pancreatitis should use Ozempic with caution and under strict medical supervision. Hypoglycemia. While Ozempic itself does not usually cause hypoglycemia, low blood sugar, it can increase the risk when used in combination with other diabetes medications, such as insulin or sulfonylureas. Symptoms of hypoglycemia include dizziness, sweating, confusion, and shakiness. It is crucial to monitor blood sugar levels regularly and to be aware of the signs of low blood sugar. Adjusting the doses of other diabetes medications may be necessary to prevent hypoglycemia when starting Ozempic. Kidney problems. Ozempic can lead to dehydration, especially if side effects such as vomiting or diarrhea are severe or prolonged. Dehydration can exacerbate kidney problems, particularly in individuals with pre-existing kidney disease. It is essential to maintain adequate fluid intake and to monitor kidney function regularly while on Ozempic. If kidney function worsens, discontinuing the medication may be necessary. Thyroid tumors. In animal studies, Ozempic has been associated with an increased risk of thyroid tumors, including medullary thyroid carcinoma, MTC. However, it is not clear whether this risk is present in humans. As a precaution, Ozempic is not recommended for individuals with a personal or family history of MTC or multiple endocrine neoplasia syndrome type 2, MEN2. Any new lumps or swelling in the neck, hoarseness, or difficulty swallowing should be reported to a healthcare provider immediately, as these could be signs of thyroid issues. Allergic reactions. Although rare, some individuals may experience serious allergic reactions to Ozempic. Symptoms can include rash, itching, swelling, particularly of the face, tongue, or throat, severe dizziness, and difficulty breathing. An allergic reaction to Ozempic requires immediate medical attention. Patients with known allergies to any component of the medication should avoid using it. Gallbladder issues. There have been reports of gallbladder problems, such as cholelithiasis, gallstones, or cholecystitis, inflammation of the gallbladder, in patients taking Ozempic. Symptoms may include severe abdominal pain, particularly in the upper right quadrant, nausea, vomiting, and fever. If gallbladder issues are suspected, a healthcare provider may recommend discontinuing the medication and seeking alternative treatments. Common side effects. Nausea. Nausea is the most frequently reported side effect of Ozempic. This occurs as the drug slows gastric emptying, allowing food to stay in the stomach longer, while nausea often diminishes over time as the body adjusts to the medication. It can be challenging for some patients. Starting at a lower dose and gradually increasing it can help manage this side effect. Eating smaller, more frequent meals and avoiding rich, Fatty foods may also reduce nausea. Vomiting. Vomiting, often associated with nausea, is another common side effect. While not everyone will experience it, those who do may find it uncomfortable. Vomiting can also lead to dehydration, especially if it is severe or prolonged. Staying hydrated and taking the medication with food may help mitigate this effect. If vomiting persists, it is essential to consult with a healthcare provider, as it could indicate that the dose needs adjustment or that the medication may not be suitable. Diarrhea. Ozempic can also cause gastrointestinal issues such as diarrhea. This can range from mild to severe and, in some cases, may lead to dehydration, especially if fluid intake is not sufficient. Adjusting the diet to include more fiber and staying hydrated can help manage this side effect. If diarrhea becomes severe or persistent, a healthcare provider may need to assess whether the benefits of continuing Ozempic outweigh the discomfort caused by this side effect. Constipation. Conversely, some individuals may experience constipation rather than diarrhea. This can be uncomfortable and may require dietary adjustments, such as increasing fiber intake or using mild laxatives under the guidance of a healthcare provider. Drinking plenty of water and maintaining regular physical activity can also help alleviate constipation. Stomach pain. Abdominal pain or discomfort is another possible side effect of Ozempic. This pain is usually mild to moderate and may be linked to the drug's effects on the digestive system. If the pain is severe or persistent, it is essential to seek medical advice, as it could indicate a more serious underlying condition, such as pancreatitis, which is a rare but serious side effect. Decreased appetite. One of the effects of Ozempic is appetite suppression, which contributes to its role in weight loss. While this can be beneficial for those trying to lose weight, it may be an unwanted side effect for others. A reduced appetite can lead to significant weight loss, which should be monitored, especially if unintended. It is crucial to maintain a balanced diet even with a decreased appetite to ensure the body gets the necessary nutrients. Fatigue. Some people may experience fatigue or a general feeling of tiredness when taking Ozempic. This can affect daily activities and overall quality of life. If fatigue is persistent or impacts the ability to perform everyday tasks, consulting with a healthcare provider is important. Fatigue may be related to the body adjusting to the medication or could be a sign of low blood sugar levels, especially if the patient is also on other diabetes medications. Long-term use. The long-term safety of Ozempic is still being studied, especially as its use for weight management has only been approved more recently. However, the data available so far suggests that it is generally safe for long-term use when prescribed for diabetes management, provided that patients are regularly monitored by their healthcare provider. Who should avoid Ozempic? Thyroid cancer risk. As previously mentioned, individuals with a history of thyroid cancer, particularly medullary thyroid carcinoma, or those with multiple endocrine neoplasia syndrome type 2 should avoid Ozempic. History of pancreatitis. Those who have experienced pancreatitis should be cautious, as Ozempic may increase the risk of recurrence. Severe gastrointestinal disorders. People with certain gastrointestinal conditions, like gastroparesis, may not tolerate Ozempic well due to its effects on slowing gastric emptying. Conclusion. Ozempic offers significant benefits for managing type 2 diabetes and aiding in weight loss, but it also comes with potential side effects that range from mild to severe. Understanding these side effects and working closely with a healthcare provider to monitor and manage them is essential to using Ozempic safely and effectively. Regular follow-ups, open communication with your healthcare team, and adherence to prescribed guidelines can help mitigate risks and maximize the benefits of this medication.